Hi, welcome to the Monday video. For all of our new followers, I am Dr. Risa Davidson. I am the pediatrician here at Little Village Pediatrics. Today we are going to discuss breath holding spells in children. These can be very scary for parents to witness, and as a physician myself and as a mom, I think if I saw my child do this, I would still completely freak out. So don't feel alone in that. So breath holding spells, they can happen in kids 6 months to 6 years of age. They're most common around age 2, but they can occur at any point in time during that age frame I discussed. About 80 to 90% of kids will have their first episode before 18 months of age. Sometimes that range of episodes will be about 1 to 6 per week, but give or take on that, that is not a set amount. The pathogenesis, or why these events really occur, is not clear. So I'm not going to go into a whole spiel on that today. We're just going to talk about breath holding spells in general. There is thought to be some family history associated with these, though. So if you yourself used to do this when you were a child, or your parent did, then there is an increased risk for breath holding spells, and there might be some kind of association with that, just so you know. This is an involuntary reflux in kids, meaning kids do not have control over this. It's usually a response to pain, anger, fear, high emotion. So getting upset with them about it is not going to help because it's really out of their control. But basically, a breath holding spell, what they do, your child will stop breathing and sometimes completely lose consciousness, and they can pass out for about a minute, which is very, very scary for a parent to witness, obviously. They look very scary, like I said, but there are no long-term risks that we're aware of associated with these. So there are 2 types of breath holding spells. There's one called cyanotic and 2 called pallid. So the first one, cyanotic, basically the child will stop breathing and they turn a dark color in the face, like a bluish purple, hence we use the word cyanotic. It is often triggered by something that upset the child. So they will exhale and then basically not take another breath. And they often just lose consciousness and then come to when their body's natural instincts are like, hey, you need to breathe. The pallid form, much less common. So the child will basically have a loss of consciousness and then breath hold, which is unusual. So it's often triggered by a sudden fright, and it's more likely to be confused with a seizure. Both of these really can be confused with a seizure for parents, obviously. So what do you do if this happens? Well, move your child to a safe place so they don't get hurt, obviously. If it's the first episode, you're definitely going to call for medical help. You're probably going to be calling 911 because you're going to completely freak out, and that's okay to do. So you're not going to know that this is a breath holding spell, and so that is going to be very scary. The next thing you'll do thereafter, obviously call your pediatrician, talk to your doctor, so you have a plan for what to do in the future when this happens. So more details on that I want you to discuss with your pediatrician, because I think it's important that they know what's going on, and then they can give you a lot of good ideas for this. They can also help determine, was this really a breath holding spell, or do we need to be concerned about other things? Because there are other things that can look like this, and we need to be able to rule that out. So one thing that we do, just a side note, we will often do some blood work to check for iron deficiency anemia, as sometimes this can basically enhance or cause breath holding spells a little bit. So that is one kind of more simple thing that pediatricians will do as a first line test. So I hope this was helpful. If you have any questions or comments, just list them below, and we will see you next week. Bye.